health services. So what then are we doing to fill these potential gaps in critical health services?
So the funding issue is a very big issue. I have attended a few conferences, I think 1 or 2. I haven't done a lot of international travel. I've really been focused on Namibia. But I've done, I think, about two international trips. And when you have conversation with other ministers of health, it's important to understand, especially other ministers of health in African countries, and I just want to establish this one fact is, I don't think we appreciate enough what the government does. And I'm saying this not just because we're at a SWAPO event, but really because all of our ARVs in Namibia, because I know when the whole stop of fund and all of that, you know, people were flooding social media with this and that, not really understanding what the government already does. So the government right now funds all of our ARVs. All of our ARVs are funded by the government. And that's important to understand, because I'm going to come to the issue and I'm going to answer the issue, because yes, we were impacted, and I'll talk about that. But that is important to understand, because if that were not the case, the impact would be so much more forceful. So right now, a lot of the countries are struggling because about 97% of their ARVs were supplied by external donors. And that becomes very problematic. So first is to appreciate the work that the government is doing. That's the first part. Now the second part is the impact still felt? Yes, it is. But how is it felt? It's really felt more in terms of, we're talking about employment. Employment is a big one, because through the partners and all of that, we have seconded staff members that are working under the ministry, but they're working or they're being paid by the donors. And that's where the problem comes in. Now, to answer that question, I'll answer it like this. I'll tell you the truth. Do I have an answer for it? No, but I have a strategy, and the reason I'm saying that is because I don't think we should be looking at it as how to sort of just plug the gaps, because that makes us reactionary, and that's what we don't want. And what we want to do is, because when this happened, there were a few comments that were shooting around where people were saying, yes, but we need to start looking for other donors. And I'm very cautious of that. And that's not my immediate go-to. Because people keep asking me, who have you reached out to, Esperance? You have to make a plan now, because the funding has been cut, so who have you reached out to? And I said, that's not really the priority. The people are the priority, but let me get something right, as to say, at a certain point in time, we need to become self-sustainable. Now, how do we get there? That's why we have conversations like this. So exactly how we get there, I don't quite have the answer, but what I can say is we need to stop looking at it like, okay, we just sort of need to fill in where they left. No. So where they employed, we must start employing the people. Where the gaps were left, we fill those gaps and we replace completely. And I said it now, we were in conclusion, we were in Malawi at the Southern Africa Regional Steering Committee for the Africa CDC for all the ministers of health. And I said it, and there were donors sitting there, and I said, it's time Africa becomes self-sufficient. And it wasn't quite a popular thing to say. The donors were looking at me like, But it's the truth. And that's very important to remember, because a lot of these systems are reliant on the fact that Africa will always need. A lot of these systems are built on that. And when you take that away, you take away a lot of power. And so those are conversations we need to start having. It's not comfortable conversations, but we need to start having those conversations, and we need to start doing more than just filling the gap, but we need to start basically finding ways to do for ourselves what they have been doing for us for years. Thank you.
Thank you, Honorable Minister. So I would like now to open the floor to the audience. Do we have any questions to our panelists? just by a raise of hands. On the left side, do we have any questions? We don't? Okay, I'm counting about 6 hands are up. Okay, 7 hands. Okay, may you just raise your hand again, please. Okay, so going back to our rules, only one question per audience member, and your question should be limited within 1 minute, please. It will be appreciated if less. Can we start with the gentleman at the front on my right? Yes, you, sir.
Thank you very much. All protocols observed. Thank you, Comrade the Minister. Thank you, Comrade MC. My name is Johannes Nampala. I am the section chairman of Section Future of SWAP Party Youth League in Okongova branch. My question is to Honorable Minister Esperance Levendam. Honorable Minister, you have indicated your intention to remove middlemen in the health procurement system. While this reform is welcome, many Namibians are currently employed under these intermediaries. In line with the SWAPO Party Manifesto Implementation Plan to create jobs and strengthen local enterprises, may I ask humbly, what measures your ministry will put in place to ensure these jobs are secured and transitioned rather than lost? It's an open question there. Furthermore, could you clarify what criteria are being applied to the select pharmaceutical manufacturers, which this is mentioned in the Namibian? You can disprove what they're saying because sometimes the journalists can say things that are wrong. In terms of what is the criteria? Because they say, apparently, you said there's a criteria list of people that are going to provide those pharmaceuticals. And how the ministry will guarantee that local content entrepreneurs and small Namibian-owned enterprises are not left behind in this process in terms of local manufacturing that is all entailed in line with our SWAPO Party Manifesto. I thank you very much.
Thank you so much. However, you did go over a minute, so I'm going to be keeping a timer. Once the minute is up, then time is up. And can we also just stick to the rules, 1 question per audience member, so that we have the opportunity to answer as many questions as possible, because now time is also going. So you asked 3 questions. So it will be up to the minister whether to answer all 3 or if she's only going to answer 1, because we have rules. Anyone else? So we're going to just take the questions and then we answer them at the end. Okay, may you just please put your hands up so we see how to go about this. Okay, so we have 1, 2, 3, 4, 5, 6, 7, 8, 9 questions. So these are the hands that we're going to be looking at. No more hands, please. So yes, the gentleman in the blue jacket. May we please have a microphone? 1 question, please, and you'll be timed.
Okay, good evening, everybody. Protocol observed. My name is Dr. Amos Itegeta. I'm currently doing my 2nd-year internship at Windhoek Central Hospital. Well, first of all, I would like to thank everybody that is here, especially the minister. This is such a very important platform where we can, as health stake workers, we can all come up together and come up with very feasible solutions. So my question to the minister is regarding the current structure where interns keep finishing and they are not being absorbed in the job market. What are you actively doing right now to address that issue? For example, we are having a case where, like you said in Okahanja, there was a video circulating where they showed about 1 doctor attending to more than 150 patients. And this is about 2 weeks ago. But then we have, okay, let me just finish this one, it's very important. But then we are having about
20 seconds.
Yes, we're having about 180 medical doctors right now in the country that are unemployed. Yet we are having spaces, we're having our parents, our family members going around, but they're not being attended to. What are you actively doing to do it, and in what is the time frame that you are looking at for this solution to be given? Thank you.
Thank you so much. The gentleman, yes, sir, your hand was up.
Thank you. Culture change is very important. The welfare of those that are taking care of us is also very important. Honorable Minister and my good Dr. Stanley, how do we make sure that we invest in the wellness of our doctor, our nurses, to make sure that they drive these systems that we are talking about? Because I still believe that the biggest asset of the Ministry of Health is not hospitals, it's not good systems, but are the people. How do we make sure that we take care of them so that they can take care of our nation?
Thank you so much. The six remaining hands. No, sorry, before you pass on the mic, the 6 remaining hands, can you please just put your hands up? 1, 2, 3, 4, 5, 6. Oh, we have more hands. Okay, sir. Okay, just put your hands up again, sorry. Okay, I'm going to only take... Okay, so I'm only going to take 3 people. No, 2 people from the side, and then we move to the side. Sir, you may proceed.
Yes, thank you. Honorable Minister, I'm not going to make this a you problem. As me being a citizen of... So, regarding
May I please speak up?
Yes, regarding the shortage of doctors, don't you think the employment of nurses into the clinics and hospitals perhaps might cure the virus of long waiting lines for patients, since we have a high rate of unemployed nurses that are currently graduating? That's the question.
Okay. Thank you so much. Last person, can we go to the back? The lady, yes, the lady in the... Okay.
Okay, good evening. I'm also, I'm a dentist. So for this question goes directly to the National Chief. So it's the same as dentists that are actually done with internship that are seated at home. And there is a lack of dentists in hospitals. So we have been told, or rather, let me make it this way. Some of us, we had the privilege to have scholarship by the government. So we signed contracts that stipulated that when we get back, we had to be absorbed by the government to get jobs. So we feel like the government is breaching this contract because they are not fulfilling their end of the deal. As we did our part, our academic end, we have fulfilled that. So we are seated at home. There have been stories of there's no money to, or rather they are working on a program where they want to place
Sorry,
us all at
time
once.
is up. What is the question? May you just restate the
Okay, the
question
thing
in 10
is-
seconds?
Okay, my question is, what is the plan with us?
Okay, thank you. Can we move to the left?
Working in the government, they don't have housing allowance, they don't have transport allowance. We still have interns working in the government, they don't have medical aid, and they are not paid overtime. I want to know, Doc, when are you going to address us? And also, Doc, we
One
still
question.
have no, it's the same thing. We still have third-year interns who are getting 2,000, is it 140 salary, and some of them are not
Time
getting
is up.
anything. When are you going to address us? Thank you.
Thank you. And then the last person on the left, and then we give over to our panelists to answer the questions.
Good evening, everyone. My name is Anna Mary Davapa Achipala. I'm a student at the University of Namibia / student leader. Honorable Minister, I would like to start off by applauding you for speaking of systematic structures that currently exist that have normalized abnormal and inconvenient traditions of efficiency and functioning to the public. Now, considering the role that healthcare providers' intentional behaviors, as you just spoke of, play in medicine stock shortages, what transparency measures and whistleblower protections will you enact or that are currently being implemented by the ministry? As you have just stated that the matter is something that you're currently working on, are you planning to put in place to ensure that frontline workers, community members, even patients in hospitals can safely report abuse or sabotage without fear of retaliation to the correct channels?
Thank you so much. If we can now just give the floor to the panelists to answer the questions. Where do we start?
Okay, good. It feels like all the questions were for me, but okay, good. Very quickly, I'll answer them. Number one, with the middlemen, it's important to understand that at no point, this is important. So I have not, neither myself, neither the president, have at any point in time stated that we are not concerned about, you know, employment or whatever else the case is. I want to phrase it this way. One of the issues that I raised at the previous youth talk that we had with firstly, a disclaimer. So he gave me the probably the most heated question. He's actually, can I give a disclaimer? Yeah, just a little disclaimer. So he's actually my brother-in-law. So I don't know why he's putting me under so much fire. Yeah, family should be exempt. But anyways. But all right, good. So let's look at it this way. I don't have a lot of time, so I'll answer it like this. We talk about the issue of middlemen, them employing people, all of that. What my focus is, and I had a meeting today with the executive director, our focus is not taking whether money, whether food away from anybody. And when we look at it that way, we've missed it completely. Completely missed it. The focus, and our focus, you see, that headline was not a headline for me. That was from things that leaked. Our focus is to say, how can we as a ministry be more efficient? That's my question. So my question is not about middlemen. And people keep trying to, you know, but Esperance, what is your opinion on middlemen? And are you trying to so that they can quote me? No. My goal, my team's goal, the deputy executive director, the whole ministry, the whole executive goal is to make the ministry more efficient. That's the goal. So when we talk about efficiency, I'll answer the first part of that efficiency is there are times when we give contracts and people do not supply. And then we end up with these issues. That's the first part. So that's addressing what efficiency. I don't mind giving you the contract, but then you must supply the medication. That's the first part. My second part is we've missed it completely because, and I'm speaking on facts, documents that has been brought to my table, where a drug costs a certain price and they've inflated it. There was a quotation that we quoted, and I got this through confidential sources. We quoted for, I think it was, they got quoted about 159,000. They charged the ministry 1 million and something Namibian dollars. So you see, if we're going to talk about middlemen, that's fine. If you want to speak on behalf of middlemen, that's fine, but we must all bring our part. So there must be rules and regulations. If you're going to be a middleman, it's okay, but you must operate within the confines that benefit. So let's not just talk about middlemen are going to lose jobs. Well, then operate in proper confines. Be reasonable when you charge. Now, let me explain to you. All of you, and I'll answer a lot of the questions in one, because I kept getting the question, doctors are unemployed. We know the doctors are unemployed. And of the budget that we've been given, and I keep highlighting this, of a $12.2 billion budget that I and the team have to work with, about 11.5 billion of that is operational. So that means just for me and the team to keep the lights on, just to employ these doctors that you see that are employed, the specialists, it costs us about 11.5, and their salaries are very, I'm joking, I'm kidding. It costs us about 11.5 billion. What does that leave us with? A couple of hundreds of millions, right? The Windhoek District Hospital is costing us how much? 3.2 billion. So you see the problems we're having. So it takes me back to this. My question is not about middlemen. And journalists, stop asking me about middlemen. We're missing it. We are trying to find a system that's more efficient. Because I'm saying, if we can find responsible middlemen, if you're responsible, it's fine. If you're responsible, it's fine. It's okay. And we find manufacturers, and we can save, like I started by saying, millions of dollars. Where does that millions go? Where does it go? No, to the gentleman there. You were asking me about doctors. Where does that go? It goes to hire doctors. It goes to hire nurses. That's what we're trying to do. That's what a friend of mine is here, and he knows very well the past 2 weeks have been very stressful for me. And stressful for me in the sense that, my biggest concern comes in when lives are at stake. That's my problem. So of the entire few months, the time that I felt the most stressed have been the past 2 weeks. Why? Because of the fact that they are lives. And I understand the issue of lives. And so what we're trying to do is not take bread away from mouths. We're trying to be more efficient. So if you're going to be a middleman, then charge a normal top-up. Yeah. Don't go and charge. Don't take us from 100 and something to $1 million and something dollars. That is robbing the system. You're robbing the government blindly. And so that is that part. With regards to the doctors and the unemployed doctors, I partially answered it, but what I'm trying to say is that there is a need. Okay, we understand the need. And I want to emphasize that because sometimes it looks like we are disconnected to what is happening on the ground. And there was a parliamentarian that, were asking questions the once, and it was a very emotive question. And I don't mind emotive questions, but you must back it up with some facts. And you must understand before bringing... So what I'm trying to say is that the doctors are a sore point. One of the questions there, she touched on myself when I was an intern. And it's important because what does that mean? I mean, I've worked at Onanjokwe, I've worked at Oshakati, I've worked at Katra, I've worked at Windhoek Central. I understand, and I worked on the current, that is it 20,000, I think, that they're getting. So no medical aid, no benefits. So I went through the system on that. So I know. To answer the next question regarding the interns, and it was asked in Parliament again, that issue has been sorted. We have not made the announcement because we are clarifying a few details. You see my Deputy Executive Director is nodding. So when we went into that meeting, the first thing that I said, and it was, we were sitting in a round table with a group of people, the registrar, etc. And, everybody had their opinion. Some people were saying, no, they shouldn't get this overtime, this and this and this. And I come to the question about mental health, where my thing was, because I've been through the system, and probably not the greatest thing for in terms of the government and treasury, because I will always advocate for the doctor. I'll always advocate for the doctor because I know what it's like. And so that issue has been resolved, that issue has been sorted. The announcement of things have been delayed because of technicalities, but it has been sorted. And we will make that official announcement very soon. And then lastly, there was a question about nurses. I want to answer this question and then I'll let the rest of the team answer. Nurses, and the question about can nurses fill that gap? And it's something that I'm very passionate about. And it's another announcement again that we will be working on soon. So you see, in other countries, a couple of years ago, I learned about nurse practitioners. And nurse practitioners, so in a lot of other countries, instead of some places being manned by doctors, where you now have to wait for the doctor, the one doctor, you have a nurse practitioner that can do 80% of what a doctor can do. And they can prescribe, they can do a physical exam, they can read x-rays and all of that. And we are currently in the final stages to finalize. A communication will be going out soon with regards to, I think, a call for applications for people or nurses who want to apply to go and study to be nurse practitioners. And once you go and you pursue that, you then come back as a nurse practitioner, so you are in between a nurse and a doctor. Which then means that at all of these facilities, instead of you waiting for one doctor, you can go to a nurse who does your blood pressure and does everything at once. Thank you.
Good news, doctors. First of all, I'm very proud that doctors came out tonight. But please, the other colleagues, I'm not leaving you out. Dentists. And I want to challenge you as colleagues a bit. And I know Amos will tell you. I worry that all of us are looking for jobs from government. Yeah? Let me paint you a scenario. A doctor, a nurse, dentist, you open a practice together. You go to the government of SWAPO and you say, this is our practice. Let's look after this community. They'll be like, what? Because none of you want to be in Greenwell. But now, if the three of you sit up there and say, we are in Greenwell, we want to look after this community, but government will charge you $50. She's here. Comrades, colleagues, we need to start thinking out of the box. 11.5 million wage bill. How much more do you? How many of you, do you know about the youth fund, doctors? Let me see. How many of you applied? You see? Don't process me. Don't process me. I'm one of you. I know how we think. I know how we think. Colleagues, this is our government. When have you seen me sitting with a minister? In which country? Yeah? Second and the last issue is the structure of our health system. Yeah? Nursing, dentists. We need to start discussing it at a certain point. Because this thing of us all looking for jobs from government is not good for government, it's not good for us. It's a bad relationship. To propose alternatives. Yeah? Community clinics manned by us. It will be cheaper for them to give us 1 billion and we run that place. Yeah? Because Amos will not be stealing the 1 billion because I'll be chasing him. So where's our money? So colleagues, let's think of alternatives, yeah? Especially my colleagues, you can't go to school for 6 years, suddenly you are waiting for people to think for you. Colleagues, dentist, did you apply to Meme Triple N Youth Fund to open a clinic? Or you want job first? The youth league is here. Here she is, deputy. Stand up. Let's go to her tomorrow. We come to her and say, for us in the medical field, we need this. Yeah? They are here. Colleagues Tara, Comrade Tara, they know me now. Do you know how they know me? Ask Comrade Tara. I'm always there, Tara. Yeah? This is our country, colleagues. We will organize. Amos, I know, will organize. I don't think the numbers that are getting produced will be employed by government colleagues. I'm being serious. Yeah? If we don't organize, and look, the sad thing about us doctors is we all want to stay here in Windhoek. Yeah? Who's going to go to Ariamsvlei? Do you know where Ariamsvlei is? Yeah? We come and say, Swapo government, we are in Ariamsvlei. We want to look after this community. It's going to be cheaper for you. Give us the money. Let them start having... Sorry? Why am I? I will answer you. Thanks. Anyone else?
Good evening. I would like to also say that I'm really proud that there is a dentist, and I hope there are also more, because I know that our voices are usually sometimes forgotten in the midst of people talking about medical doctors and nurses. Sometimes you may feel that you are not being heard, but I would like to reassure you that as the National Chief Dentist, I'm definitely your voice piece and your advocate at the Ministry of Health. And I know your frustrations, and I know that, because I get a lot of phone calls, a lot of texts, and it gives me sleepless nights, I can tell you now. So in terms of what is the plan, I think you've heard from our boss also that a plan is in place. And one of the plans that we want to do, that we have already planned to do, and that we're going to implement, is to employ you and place you in places of need, where the need is. Like Dr. Kanyemba said, a lot of you want to be in Windhoek, but the need are really there in Congo, in Aranos, and that's where we want to place you and to employ you. And we want you to go there to serve the communities. So yes, so basically you are important, your voices are important, your frustrations are well heard. And I want you, because I know I get a lot of these questions, but us dentists, we are not cared for. That's what they keep on texting me. Nobody cares about us, nobody cares about oral health, but we do. And our minister is here, she's very passionate about wellness and mental health of all people, including the staff members, so, which also includes dentists. So there is a plan in place for you. I know the long wait can be frustrating, but know that we are not sleeping. Some of us are not sleeping. We are thinking about you, we are planning, we are implementing those plans, and we want you to really be employed and give back and plow back to the community of Namibia, especially where the need is. Yes, thank you.
Thank you, Doctor. All the questions were answered, I believe. I would like to believe. Okay, your question wasn't answered? You directed your question to Honorable Minister and Dr. Stanley, if I remember correctly.
They know me very well. You see, Comrade Tara, they know me very well. I'm also involved at the ground at Central Hospital. One of the things that we've been complaining about is you're on call, you want food, there's nothing. Yeah? I know for a fact Comrade Herman, I think he's a comrade, I am allowed to call him a comrade, right? Yeah? They are busy trying to build facilities for us to sit. They are busy trying to build a library. They're busy trying to build a gym. We have heard you.
Was your question answered, sir? Awesome. So I did promise that we'll have two last questions, the final round. And we had hands behind. I didn't touch at the back. We had hands behind. I had two hands at the back. Okay, so now it's fine. I have one hand at the back, and then I have you. I'll include you. Can we start with the lady at the back? Just 2 questions, same rules, 1 minute, and then we round it off.
Okay, good evening, everyone. So my name is Shalom Shivola, and my question is basically around intentionality, because we heard a lot about intentionality, accountability, and inefficiency being mentioned. So I would just like to, mine is part comment, part question. So I would just like to say that intentionality doesn't necessarily mean immediate impact, right? So with this said, how do you plan on ensuring that your intentions have the impact that
You're talking to her on WhatsApp now. And if you want to upset her, the worst thing that you can do is say, it's a work in progress. That is the easiest way to ruin both your days, because that conversation is not going to go very well. And so intentionality without action is not something that she tolerates. She's made that very clear. I know there's a lot of things that we need to fix. I continue to remind us that all these things are not going to be fixed in one day, but I think we can all at least say that there have been some signs of change. There have been some areas where we can look and say, okay, look, this has not been this way, and it's changing. And so I think I speak for myself and in the entire executive team and the entire ministry when I say that intentionality, and I speak from the 22nd of March until now, and going forward, intentionality is met with action. Then I want to answer the last question. My goodness, I'm very hungry. I'm forgetting all the questions. The last question was about rural areas. So if there's one thing we're very intentional about, and I think I answered it partially when I started to say we're very intentional about making sure that the executive director and myself must visit every single hospital and every single clinic in Namibia. That is a starting point. We have not, and I speak for myself once again and my team, we have not in any way, even the specialists. And you see, this is a thing that I spoke I was speaking about, and I said we must be very careful, because sometimes just because things are not outwardly doesn't mean there's not work being done. There's a lot of work that these specialists do going out into the rural areas, doing clinics, catering for people in the rural areas, doing endoscopy clinics. There's a lot of work being done. I myself have not had good sleep the past few weeks because the goal is to go everywhere. You go to Otapi, you go to Enana, you go where, you go to Okongo, you go to Onanchokwe. That is the goal, and we will not sleep until we go to every area. So I think it is important to redirect that notion and say, at least for this administration, we are very intentional about rural areas. We've been very intentional about giving them the resources, the skills, the people, as well as the equipment. Because you said something important, and in conclusion, it's something that breaks my heart. There are certain things that shouldn't be that way. I went to the South and I found out the South has not had a CT scan since independence, is what they told me. And I was asking myself, how is that possible? That's what I was told. And I said, how is that possible? A CT scan that costs about 8 million, 6 million, 10 million. So that's where I talk about intentionality. And I quickly got on the phone, spoke to another minister, and said one of their companies must sponsor me a CT scan. So I'm waiting for a response on that. But the point of the matter there is, there are other issues. There's the MRI machine that we've not had in the public sector in Namibia since independence. So you see, that's where I talk about intentionality. But like the specialist now mentioned, where he said that ultimately, the goal is to say that we don't want the people in the regions to have to come in. And that's what you mentioned that I love. And that's critical, and that's what we're trying to do. We want to have a referral hospital in every region. And in order to do that, we need to stock it up. They must have a CT scan, they must have an MRI machine. And so, are we giving the region attention? Yes. Do they need more attention? 100%. Thank you.
Thank you, Honorable Minister. So I believe my work here is done. And so as we come to... Yes, comrade.
It's mostly almost a follow-up to what she have proposed, asked. And I think I just want to propose something, and it's something in line with what she said. I don't remember what time of the year, our minister spoke about AI doctors, AI ambulance or something like that. And I'm a fan of IT. And I was just thinking to say, and you are talking about transporting patients from one region to another region. And with technology, is it not possible that we can maybe have screens or monitors where we can connect via Zoom, where as a doctor you are seated in Windhoek, you are sitting with patients that are in Okongo, for example. In a screen, there's a nurse or somebody who is with the patient, and explaining, and you send through that information to the doctor in Windhoek. Is that something that patients and explaining, and you send through that information to the doctor in Windhoek? Is that something that we can try as a country so that we minimize the transportation? I'm a fan of IT, that's why I'm thinking like that. I believe Comrade Matthew.
Yeah, okay, good. So to answer that very briefly, we have this and we can use the technology that we have
Viva Swapo Party Youth League, viva! Viva Swapo Party Elders Council, viva! Viva Swapo Party Women's Council, viva! Viva NECA, viva! Viva Swapo Pioneers, viva! Viva Swapo Party Regional Coordinators, viva! The Central Committee of Swapo Party, the National Executive of Swapo Party Youth League, the Central Committee of Swapo Party Youth League, the Political Bureau. Thank you, comrades. I'm not going to waste any time. Yeah, you may sit. Thank you. And I will invite Comrade Dr. Theo Ben Kandetu to summarize what we all witness. He is a member of Swapo Party Youth League Advisory and Technical Committee. Thank you, comrade.
Thank you, my comrade, thank you. Yes, thank you, comrade chair, comrade moderator for the opportunity. Thank you also for the esteemed, rich panel discussion that we had. Really, it is inspiring for us to see the quality of debate, the quality of discussions that we had here today, brought to you by the Swapo Party Youth League. This is outstanding work. Thank you. Thank you very much. And it really also underscores really what we already know to be true, which is that the youth are the future of the nation. The youth should be at the center of decision-making spheres, because the youth are the ones who have the solutions that will thrust us to socio-economic development. So, and this is something that we really saw unfolding this evening. So we thank you for the rich panel discussion we had, Madam Moderator. We thank you also, and also for the engaging Q&A session. As has been mentioned, my task here really is just to summarize the discussion that we had and to provide a bit of takeaways. Oops, apologies, sorry. Yeah, and so with that, you see I'm still relying on my laptop because we only just concluded the discussion. So I had to quickly type out something, and I hope really I have done justice in terms of reflecting the conversation in a summary format and to providing you with some key takeaways. Now, before I go in, I did take note that there were a number of you in the audience here who had raised your number where you can still raise those questions, and those questions will be forwarded to the panel, to the Honorable Minister of Health and Social Services and her team to address. We'll receive feedback for those questions that have not been asked. And so I wish to just quickly recite the number that you can share your questions to. 081 554 777. Do we all have it? Someone is saying no there. 081 554 777, please. So, with that out of the way, allow me just quickly to give a snapshot, and really this is just in the interest of time, and I will not mention who said what, who asked what. This is just a summary of the discussion and key takeaways. And so there was quite a rich debate here, spanning a number of themes and topics in public health. So, and you would also have noted in the responses, and actually also in many of the questions, there are central themes. There are themes that are cutting across. And so, with that said, I will just provide a summary in terms of the themes that we have discussed here this evening. So one, of course, was medical procurement challenges, where we discussed inefficiencies of staff and the systems which contribute to shortages of medicines and clinical supplies. We spoke about the need for intentional change and reinvestment in sustainable procurement systems, pharmaceuticals. It is good to have them, but implementation and accountability are more important. Implementation and accountability are vital for the effectiveness of the procurement system. Then we spoke about supply chain management improvements. Understanding the market and supplier capabilities is essential. Strengthening the current system with effective mechanisms to minimize human error. Again, looking at leveraging AI and digital solutions to minimize that element of human error. You all know what I'm talking about, as the Honorable Minister had said. We don't have to say things. You all know what I'm talking about, as the Honorable Minister had said. We don't have to say things. You know, we know what we are talking about when we are talking about human error, whether that error is intentional or accidental. Someone caught the joke. Yeah. So spoke about developing a proper inventory management system. Accountability and clear roles are necessary in that. And again, innovation should be embraced. Again, one of these central themes here this evening was accountability, right? Improving accountability. And how we do that is through digital solutions for transparency, for inclusiveness. We spoke about focusing on ensuring end users have the necessary medicines, and this is something, of course, that the Honorable Minister also again reiterated, that for the ministry, we are mandated really to provide and protect public health. To be able to do that, we have to empower our doctors, we have to empower our nurses, we have to empower our dentists, our psychologists, our health workers with the tools that they need to deliver the health care services so that we have improved patient outcomes. And for that to happen, we need medicines. We need the medicines to be to be procured on time, to be supplied to us on time. And so if we have suppliers who are not doing their job, either they are taking too long, and you know, by the time the medicines come in, you know, the patients are already dead. I mean, you know, these are some of the realities, right? And so we cannot just stand by and you know, watch this happen, because these are our aunts, our uncles, our mothers, our fathers, our brothers, and our sisters who are, you know, developing disease, increasing the disease burden, and then, you know, even dying just because medicines are not in our health facilities. Suppliers are not supplying on act, and also penalizing contraventions. We spoke about the HPV vaccine, rollout, education, tailoring information, tailoring information to the audience and debunking misinformation, highlighting the benefits of the vaccine, collaboration between public and private sector is important here. And again, we thank Dr. Kanyemba for highlighting that, and those also who spoke in favor of that. We also spoke about the US funding withdrawal. And thank you, Honorable Minister, really for highlighting the successes of the government of the Republic of Namibia in that regard, that funds 100% of ARVs and will continue to do so, despite the funding cuts from the USA. And then also, of course, we spoke about the need for self-sufficiency and absorbing staff into the ministry's structure. Key takeaways, and again, I will make this brief, is the following. Number one, systemic improvements. There's a strong need to address inefficiencies in the medical procurement system through better management, digital solutions, and clear accountability. Number two, proactive measures. Intentional efforts are required to educate the public about the HPV vaccine and counter misinformation. And I would say disinformation, because there is a difference between misinformation and disinformation. One, misinformation is where the information is inaccurate, but those who are spreading it do not necessarily know that the information is inaccurate. And disinformation, of course, is where there is a intentional, or where the person knows that this information is inaccurate, but they are spreading it anyways, just to spear, anxiety and panic. And so it's important that we know what the source of that in those individuals are, and address it head on. We spoke also, number three, about self-sufficiency. Namibia needs to become more self-sufficient in funding its health sector, especially with the withdrawal of the US funding. Workforce development, addressing unemployment among medical professionals, and investing in their well-being is crucial for the nation's healthcare. And then the last one is transparency. Transparency and accountability are recurring themes, emphasizing the need for clear roles, digital solutions, protection for whistleblowers, which is also one of the questions that was asked. So with that said, Director of Ceremonies, I had just a few moments to craft all of this, but of course, as a SPYL advisory technical committee, we will still compile a thorough summary and takeaways, and we will definitely make sure to give that to the Minister of Health and Social Services, so that herself and her team can consider it and really reflect and put it into action, because they are there because you are here. So thank you.
Viva, comrade Candidato, viva! Viva! Viva, comrade Candidato, viva! Viva! A round of applause for comrade. I actually appreciate the way you have captured the essence of this conversation. Next on the program, we are not going to waste time. Allow me to call on Comrade Ismail Shafanya, a member of SPYL Commerce Regional Executive.
Viva, Comrade Ephraim Nekongo, Secretary of the SWAPO Party Youth League, viva! Viva! Viva, Comrade Christina Indaka, Mother of the Young Lions, viva! Viva! Viva, Commerce Region, viva! Viva! Thank you. Director of Proceedings, allow me to stand on the protocol observed. I woke up and my voice was sort of failing me, But when the SWAPO party, the mighty SWAPO party, to Comrade Honorable Shafishuna Nuyoma, the Commerce Regional Secretary, as well as the Governor of the Commerce Region, for entrusting me with the honor of delivering these closing remarks on his behalf. Despite his delegation, his dedication to the youth cause of youth empowerment resonates profoundly throughout this engagement, and me being here is truly a testament of this. This engagement was not just another talk, but a direct and timely response to the pressing real-life concerns of Namibian youth and communities who are affected by the issues that were discussed here today. As we reflect on the insightful addresses delivered by our distinguished panelists, let us remain steadfast in our commitment to delivering for our people and being change makers. The expected outcomes of these talks are not merely aspirations, but tangible steps towards a brighter future. Through increased awareness of platforms like this, we are laying the groundwork for a prosperous society.
Thank you, comrade, for that warm of our program. Thank you for keeping up with me. Thank you for coming. So we are only going to do the